So here we are at the chiropractic clinic in Didcot, and I just thought I would tell you about a patient that I saw earlier, a chap who's been getting quite a lot of back pain. And chiropractors, of course, are known for treating back problems, using manipulative techniques for problems with the spine. But of course, not every back pain is a spinal problem. And this chap had quite a lot of soreness around his muscles in his back over to one side, and poking in his flank here. He was quite sensitive, and his pain had been quite severe. And what I did was to do a urine test, and I used a dipstick test to see whether there was anything wrong with his urine, because I suspected that he had a kidney stone. And I thought I'd show you the results of this little test here, because indeed there was some blood in his urine, and I'll show you on the dipstick what we could see here. So I'll move the camera, and hopefully you can see this. And if I just hold the dipstick about here, you can see that there are a number of colour patches on the stick, and the fourth one up from the bottom, sorry, the fifth one up from the bottom, is the one that tests for the presence of blood. It should ordinarily be a yellow square, but you can see it's very distinctly quite a dark green, so there's quite a lot of blood in his urine. So obviously a number of things can cause blood in the urine. One of them is kidney stones, but you can also get blood in the urine if you've got a urinary tract infection. But you'd also see white blood cells, and you'd see nitrite specifically, but neither of those can be seen on the urine test today. Obviously with females, when we're doing the dipstick test, you can get menstrual contamination, so you have to be careful to interpret the urine test in the light of menstruation. Some people do have blood in their urine anyway, and they send them for all sorts of renal and urinary tract investigations, and everything's normal. Even when they're feeling fine, there's still blood in their urine, and it's just normal for them. Some people just do have blood in their urine, but there's quite a bit of blood in this chap's urine, and so we need to send him for some investigations, and ideally we'll organise an ultrasound scan and see if we can see a kidney stone. So I thought you'd be interested in that. Not every back pain is a spinal problem. Funnily enough, though, we probably can help this guy's pain. Obviously, when you work on the muscles and relieve some of the muscle spasm, that gives the patient quite a bit of pain relief. So even though the cause of the problem is probably a kidney stone, actually, physical treatments, chiropractic treatment, acupuncture techniques, stretching techniques often will be quite helpful in relieving the pain, although they're not relieving or curing the problem. It doesn't mean that we can't help the patient. So he went away a bit more comfortable when he came in, which is great. But it was interesting just to see that, and I thought you'd be interested in that. So thanks for watching, and catch up with you soon. Okay, bye.